All right, now we're going to talk about the scapular exercise. Now this is ideal if we're trying to correct a curvature in the thoracic spine or the mid-back. Now you have to understand it's very hard to correct the thoracic spine because we have rib articulations that go all the way from the back to all the way into the sternum. All right, so how do we correct this area? Well, it's really simple. We're going to use the bone, that wing bone in our back called our scapula. Now, if we have a curvature here in our mid-back, what we'll do is we'll have a scapula on the left side, and what we're gonna do is we're gonna put pressure into that spine so that we can restore proper function and proper spinal hygiene to correct that curvature. If you look at it from the x-rays, you can see this curvature in the thoracic spine. Now, the apex of this curve is at T5, kind of right in the middle of that thoracic spine. So she's going to demonstrate how to correct this through this scapular therapy, all right? So the first thing she's going to do is she's going to position her arm. For the T5, she's actually going to position her arm to where it's level right here. Now what we want to do is we want to initiate squeezing the scapula into the spine. Again, so we're pushing these muscles left to right to correct this curvature. So she's doing this perfectly. I mean, this is ideal to where she started out with just shoulder level, and then she squeezes her scapula in, and then she's bracing that to hold that right there using the door face right now. So she's only going to hold this for about 1 to 2 minutes. That is it, all right? And then once she's done that, she can relax, and then she's all done. Now, if we have a curvature that's a little bit higher in the thoracic spine, T1, 2, T3, she's actually going to raise her arm up to about this height right here. And then again, she's going to think about squeezing, the scapula into her spine, walk into the door, and hold it right there. Now, as you can see, she's in ideal posture right now. Her head is straight, her torso is straight, her hips are straight. Everything is working together in proper posture just to create that dynamic response we want to correct the curve. Now, for the lower thoracic spine right here, that TL junction, now we're actually going to lower her arm pretty far down, about right there. And again, now she's going to think about squeezing the elbow, to get that scapula to push forward. Now she's going to walk, and she's going to walk into that door. And again, you can see it. You can literally see her scapula pushing left to right into that curvature right here to restore that proper balance. All right, again, you only got to hold this stretch for about 1 to 2 minutes each and every day, and that's going to help, along with your chiropractic visits, to restore that thoracic curve.